John's one.
It's 11:35. We'll go ahead and get this meeting called to order. I'll ask for a motion. Everybody should have gotten the minutes from the January 9th, 2025. We have a motion.
Second.
We have a motion and second. Any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Motion carries. Thank you.
Just a point of order, we have representatives of the public here. I don't know if there's a comment period on the agenda where we want to receive that or not.
There needs to be.
Just before we get into.
All right, well, and comments regarding the agenda?
I guess it would be warden's report, since I'm not entirely sure what's in it. So I guess it would be anything related to the prison, right? First would be a Sunshine Act violation with the advertisement. It doesn't specify when the meetings are at the prison, so there's no way of knowing where the meeting would be at. And then this is a rumor, so I just want to get it clarified.
We love rumors.
No. Yeah.
Sorry. Somebody that knows somebody that's in the prison said that the public defender's office phone number was blocked for a while, and they couldn't call the public defender's office when they tried. Is that accurate?
They're currently allowed to call the public defender's office.
Was there a moment that they couldn't? Okay.
You got comments, you don't have to answer.
Right.
Yeah.
All right.
Yep, that's everything for today. Thank you.
All right. Before we get to warden's report, we'll make one. I want to ask for a motion to add Dr. Roscoe.
Yeah, I'd like to make that motion at Dr. Roscoe to discuss medical.
Right.
I will second.
All right. We have a motion and a second. Is there any further discussion?
It was just to receive information.
Yes. Yep. All right. We have a motion and a second. Is there any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Motion carries. All right. Now we'll move to the warden's report.
So today's current population, well, as of February 11th, is 162. 123 males, 34 females, 5 in other institutions. We got 1 on daily work release, 2 county maintenance, nobody on CWIP. We had a bunch of new hires for part-time officers, W. Compton, H. Lodimer, C. Huff, E. Knapp, and B. Carr. I have 7 full-time sergeants, no vacancies, 29 full-time officers, 7 vacancies, and 9 part-time officers. Mr. Hartman and Ms. Panabaker were terminated from employment, and Mr. Sugar resigned from his full-time officer's position to seek other employment at Tioga County. At $16,650 in gross sales for Keith Commissary, with a commission of $6,001.50. I had 3 on a constant watch. Inmate Porter was placed on a constant watch for attempting to harm himself. Inmate Brown was placed on a constant watch for refusing to complete the intake process. That's part of our policy. And then Mr. Wintermute was placed on a constant watch. He was currently on one from Chemung County. He came to us that way. So none of these folks are currently still on that watch. Had 4 transported to medical. 1 male RPH for a vac butainer malfunction. He had a wound vac. 1 male to Towanda Memorial Hospital for seizure issues. That gentleman was placed in RHU for falsifying the situation. We had 1 male to Towanda Memorial for seizure issues. He returned with no further issues, and 1 male to RPH for head and back injuries. He's still currently there. Had 3 PREA complaints. Inmate Higginbotham made sexual remarks to inmate Vanderpool. That PREA was unsubstantiated. Inmates on Delta unit were sexually harassed inmate Jackson. That PREA was unfounded as it was a race issue, not a sexual harassment one. And on the 29th, inmate Roberts made sexual comments to inmate Banning. The PREA was unfounded as Mr. Roberts was sent to state prison. 4 new charges. Caparuso was placed in a restraint chair for attempting to harm himself. No officer was hurt during that situation. Inmate Richardson and inmate Burkholder were charged with fighting. PSP was notified. Once again, no officer was hurt during this incident. Inmate Pike and inmate Gore were charged with fighting. PSP was notified. No officer hurt during that situation. And on to 8, inmate Shelf was charged with attempted escape, aggravated harassment, and institutional vandalism. PSP was notified. And no officer was hurt during that situation. Supervised bail, we had 8 court placements, 3 magisterial placements, 5 DRO, for a total of 16 this month. We currently have a total of 40 criminal cases and 36 DRO cases for an average of 79 for the year. And that's it for the warden's report.
Okay, I will entertain a motion to approve the warden's report.
So move. Second.
We have a motion and a second. Any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Motion carries. Communications. None? There is no unfinished business. New business. Motion to ratify, I'll entertain a motion to ratify action taken on January 9th, 2025, or January 9th, 2025 meeting. Since our last meeting, the Commissioner's Office became aware that despite the formal action taken on December 26th, 2024 meeting to advertise all 2025 meeting dates, there was a delay in publication due to an administrative oversight. As a result, our meeting schedule was not published in the newspaper before our first meeting in January of 2025. All other notices and posting requirements were met. So I'll entertain motion.
So move.
Second. Any comment? If not, all in favor signify by saying aye.
Aye.
Any opposed? Motion carries. All right, Dr. Roscoe.
So I'd like to introduce Dr. Roscoe and Ben. He took over the practice for Dr. Kama. And when Dr. Kama did the medical, by the way, this is not a reflection on the service of prime care, the medical that's there now. This is 100% budgetary is what it is. So and today is only a discussion. It's just a kind of fact finding to where they can ask questions and we can ask questions. But how long have we had prime care for?
Since 2017, I believe, 2018, somewhere there.
Ed brought prime care to the table and we put them in. And back then it was, I think we're spending we're staying with about $400,000, I think, on medical at the jail. And today we spend $1.2 million, which is about $4,000 a day. And then we were like 200 inmates, and today what was the average today?
162, I think.
Yeah, they're doing a terrific job. So I got to meet Dr. Roscoe, and he took Dr. Kama, and I just asked him if he did prisons, and what kind of experience he had there, and he started looking into it. And we've had a conversation because $4,000 a day, we'd be not doing our jobs if we didn't take a look at it and make sure that to see if maybe in the future we could trim some of that back. So I guess that this is just a fact finding, right?
Yep.
And so I'll kick it off to you, Dr. Roscoe.
Yeah, so just a quick background about who we are. I've been in practice for about 20 years. I started private practice about 15 years ago, and we've expanded that private practice to include 10 primary care offices across the state, including here in Towanda. We cover 85 nursing facilities across the state, several personal care homes. About 2 years ago, we got into addiction and recovery medicine and provide medical director services to several inpatient and outpatient recovery facilities. And then last year, we got involved in corrections medicine. Currently, we're providing medical care for Columbia County and Montour County jails. And then Doug had approached me about looking at Bradford County, and we started to investigate a little bit more about what the regulations were and how we could provide some sort of service to your facility here. And I think what we've learned, having worked for Columbia and now Montour, there is several areas where we could potentially cut some fat, so to speak, and looking at what the actual regulations are versus what is the actual service being provided. So, for example, Columbia has an on-site provider 2 days a week, but they have nursing staff there present 24 hours a day, 7 days a week, which is not part of the regulation. If we look at Montour County in comparison, Montour County has a provider there 1 day every other week and has no nursing staff present in the building at any given time. So that you can imagine the cost discrepancy between the two, having on-site nursing care 24 hours a day and provided 2 days a week to a provider 2 days a month and no on-site nursing care. So I think there is a happy medium though where we can look at that and say we can cut costs while still providing the same or similar level of care that prime care is providing. And from very preliminary estimates, what we're looking at provide something like 24-hour-a-day care by a licensed medical staff, not an RN, but maybe an LPN or medical assistant, and then providing a reasonable amount of provider time in the facility, being a physician or a nurse practitioner. We're looking at a number somewhere in this $450 to $550 per year range. So I think considerable savings over what prime care is charging with an equivalent level of service. You brought up psychiatric care. We don't currently provide psychiatric care.
Well, it means mental health.
Mental health.
Yeah.
Mental health care. We don't currently do that in our any of the jails, but we do provide mental health care at some of the addiction recovery facilities we go to, and would be willing to look at something where we could provide that here in Bradford County as well.
So just to kick this out, I talked to Mae, our head of human services, and she thought that she could provide that care because they used to do it. But and I guess this is probably kickoff. And one of the Commissioner Miller, one of his concerns, and back when Ed brought prime care to the table, we had a hard time finding docs. We had a hard time finding nursing staff. It was just and they brought something to the table that solved a lot of needs for us. So I guess my question is, do you hire your own medical staff? I'll say that because I don't, I know RNs aren't LPNs, but when you get to the
all the medical staff relating to medical care of the inmates. So the counties involved aren't hiring,
Correct.
augmenting medical staff within the facility. Your approach is you provide.
Yeah, and our kind of standpoint is if we're going to be responsible for the actions of those staff and what their responsibilities are, we want them on our team, and so we would be responsible for hiring, training, and maintaining their employment.
You don't currently do that though at Columbia County,
We don't.
right?
No.
Right.
As far as practice-wide, we're kind of in the business of hiring and training nurses and providers. Our current staff is almost 200 full-time employees across the state, and it basically keeps them employed full-time is hiring and training staff.
There's another aspect of this too, depending on the level of care and what that's provided in an institution like a jail, is that if there's not medical care right there most of the time, if something were to happen, you have to transport that inmate to a medical facility, and that changes the dynamics of the cost structure of what's being provided.
Sure. Yeah, absolutely. We're not on site 24 hours a day, 7 days a week. We're not doing any kind of aggressive interventional procedures or surgery or delivering a baby or anything like that. So there would be certain transfers out to the emergency room, that kind of thing. But I like to think that we're fairly well versed at that, and we're currently under the gun from Medicare with these 85 nursing homes we go to, and then there's a huge pressure on the providers and the facilities to minimize those ER visits. And so again, we're constantly having meetings with our providers talking about that ER transfer, what's an appropriate ER transfer, what are we managing in-house, or what can we wait till tomorrow morning when the doctor shows up. So we're sensitive to those issues. Same thing with pharmacy costs. While some medications are going to be $1,500 a month, there certainly is going to be an alternative that's $3 a month. And it's kind of our provider's job to know that and be able to work with the pharmacy and the patient to say, hey, we can provide the same level of care, but it's going to be a different medication while you're here. And then once you get out of here or go to state or whatever, you can go back to what you were on before.
Your formulary, right? You'll have a specific formulary in place.
Exactly. So, and usually, the formularies that are fairly reasonable are pretty extensive. We're talking about 200, 300 different medications on that formulary. Now, we brought up things like HIV or hepatitis C or something. Those are maybe some outliers that we would have a hard time getting a $3 a month alternative for. But I think by and large, the vast majority of medications we can find reasonably priced alternatives.
So 2 questions. You talked about that you're providing some level of mental health care, not at jails, but at addiction facilities. Are you aware, maybe you don't know the answer, the difference in terms of regulations between what the level of care is? For example, would it be a licensed clinical social worker at, say, for example, a facility for addiction, as opposed to, I don't know if this is the case, but for example, a master's of social work needed at a incarcerated or jail facility. So that's one where I think, as you as you think about it, I guess do you know what the difference is?
I don't know what the regulations are, I'll have to look into that. Currently, what we're providing is a psychiatric certified nurse practitioner,
Okay.
which just seems to be kind of the standard of care, especially in the long-term care.
And that individual has the ability to prescribe medications?
Correct.
Okay.
Yeah.
And so then the second piece of it is one of the things that I know is near and dear to your heart. I'm just kidding. But is one of those things that we always hear is coming down the pipe from the state is whether medical assisted treatment will be, pharmaceutical assisted treatment is something that's going to be required going forward. And so, from a costing perspective, has that been salted in as if this, then this would be the cost, but if that, this would be the cost? I don't know if you arrived at hard numbers. I'm just wondering whether.
Yeah, so I mean that's included in that, and we're doing MAP at Columbia County, and we do obviously the addiction recovery facilities.
So you have some hard numbers, at least on Columbia County, that you could extrapolate from.
Correct.
To figure out what that would be if the county either was required to do that or if the county desired
Absolutely.
to do that. Okay.
How big is Columbia County?
The county currently had 170-ish inmates.
So close.
Close to us.
Comparable to.
But they're getting reimbursed for 50 of them, they're federal inmates. They have a contract with the feds.
Oh, okay.
So they're
Like they're coming from Allenwood or
from wherever the U.S. Marshal Service brings them
sets them
to.
in
So,
there and that's.
They also house a lot for,
well,
for sold in Wyoming.
they were hot, they
They
were, but the judge there brought them all back to Wyoming County. So,
yeah.
yeah, but yeah, so their average daily population for Columbia County is about 120s, but with the feds, they have 50 more on top of whatever their ADP is.
So we've also been dealing with the feds and, back and forth to get things paid for on a federal level, so we're in straight into that process as well.
The mental health piece is it's huge for us, not just in our jail, but it's an epidemic across the Commonwealth, as you guys are probably aware of. So we currently have 2 clinicians that work in the jail. They were county employees before, and when Prime Care took over, they became Prime Care employees as they stayed with us. We know that's a little bit of an overkill. We don't necessarily need to, but we have to. So what do you guys do do you provide clinicians for that, or just do the telehealth piece with your nurse practitioner? I'm assuming the psych doc is telehealth, because that seems to be what the majority of the people do.
Sometimes and often we do a mixture where, geographically, sometimes, the rural areas are hard to reach a person. But a lot of times we will do an on-site visit at least once per month, and then telemedicine at other times. Telemedicine is still, currently approved by Medicare as an acceptable form of treatment.
Okay.
So we certainly utilize it, but our preference is going to be on-site, in-person mental health care as well as medical care.
Are there any state required, whether this is, I don't know what the Department of Corrections does, but are there any type of publicly available reviews of your work at Columbia or Montreal that are available?
I don't know the answer to that.
I don't know about publicly available, we could get you in touch with Ward and I.
Just, yeah.
I think you called them. didn't you?
No, but I'm saying,
I spoke to this deputy, he was on vacation when I called. Talked to
They
her.
get vacation down there?
Yeah,
Don't you be listening to them.
Don't-
You don't need a vacation.
We're sorry we went, yeah.
so, okay,
Yeah.
so, but I guess what I'm saying is there's some level of third-party objective oversight or objective review.
We can provide references.
And again, just to reiterate, and this is just obviously a discussion, but potentially you're able to provide basically an all-encompassing package of where the county is not hiring medical, like staff, nurses, aides, any of that stuff.
Sure. What we can provide is a medical provider,
Mhm.
on-site nursing care to pass medication and evaluate inmates, and pharmaceuticals. And then the fourth piece would be plus or minus mental health care, depending on what you're desiring.
So you're saying that while a nurse practitioner or physician could prescribe it, you're saying that your understanding of the regs is that an RN is not necessarily on site 24/7, is you could have a medical assistant or an LPN who is administering a previously prescribed medication.
Correct, and from my understanding of the actual law, an RN is not required to be on site at all.
Okay.
And Columbia is run by an LPN, and Montour has no nurses whatsoever.
So and I did bring it with me, but Title 37 has the basic minimum standards for healthcare.
Right.
And I know one of them is, an inmate has to be seen within 24 hours of incarceration by a medical professional. And whether that's the doc or the nurse, and I don't know the medical side of it all that well, but I know the reason why we have one RN, and the reason why we have her is because she can do the physicals and do all that stuff that a doc would do, but isn't there, and the LPN can't do because that's their licensure and how that works in that medical world. So that's why we had her.
So related to that, and I guess the question is do you administer it through, for example, in that context of Columbia County, something like a blend, where you have, say, an LPN who is on site and then an RN who is participating telephonically or through Zoom in the room? So is that the model where you're having an off-site person who's present but telephonically or?
But right now at Columbia, there's no RNs present at all, but their director of nursing or their head nurse is an LPN.
So the LPN.
And that's a county employee.
That's a county.
And that LPN is the one who is doing what the warden referenced is that 24-hour assessment.
Correct.
Is being done by an LPN, and that is all DOC's has no problem with that, is what you're saying.
From my understanding of it, correct. And they just hired MAs at Columbia County, and that's what they consulted us into doing this legal. And we did the kind of, our armchair quarterback review of the law, and there was no legislation talking anything about RNs versus LPNs versus medical assistants, all of whom were trained to pass medications and take vital signs and evaluate patients.
Yeah, it's just that it doesn't say, you're right, it doesn't say who has to do just has to be done within that first 24 hours, right? That's who has to be. This can't be a CO.
Right.
Gotta be somebody.
We probably don't want it to be a CO.
Well, I think we used to have COs doing med handouts.
We did, and
We don't want to do
No,
that.
your warden does not want to do
No.
that
No, we
at all,
don't.
ever.
I think I told you that right when we first.
I think it's probably safer for everybody involved, including
Yes.
me and my staff,
Yes.
is to make sure that there's somebody who's licensed doing
Absolutely.
that.
Because those folks make mistakes every now and then too,
Sure.
so.
We all do.
The only thing we haven't discussed in terms of like that a la carte services that are being provided is that Act 22 liaison and that PINX contract in terms of cost reduction. So I don't know if we want to.
Are you guys familiar with that?
Yeah, so, yeah, we were in clinic at one time, but we're currently not. Prime Care takes over for that for us, so they do the same thing where they argue,
So we do not have that part of our current service, but we would probably fall back on, I'm blanking on the name of the company that's the law firm that works with Henry. Julia Alday is the lady's name who runs the program.
So maybe you can explain that a little bit deeper, but we could go back with PIMIC, couldn't we?
From our
I
conversation
think
with her,
there's like a membership, a
it's
joint
a
permit.
membership fee, right?
And
yeah,
then
that's roughly $40,000-ish, like,
Okay.
Here.
for a year, if I remember correctly.
Okay.
So I'm unfamiliar with this acronym. So this is a group that is contracted with, and they're the ones who essentially argue whether things should be reimbursed or not, or covered or not. It's
Prison inmate medical
Yeah, get from it.
management.
control, cost
Agent,
control.
cost control,
Yeah.
yeah. Had to see which word my letters
But
were.
they're the liaison for Act 22. So Act 22 is a law, the regulation that says correctional facilities shouldn't have to pay more than X, Y, Z. And the examples are dramatic. I mean, they're dramatic where it's like a $10,000 bill, all of a sudden becomes $500 or $600 after that.
cost control.
True up of that, because Geisinger or Robert Packer is going to submit you a bill saying, we performed $10,000 worth of services, and then whoever is helping you manage that contract or that bill will say, yeah, but the PIVC requirement or the Act 22 obligation for the prison is only gonna be X. And so we're gonna pay the $500 and that's what we're gonna pay. And so there is that kind of, but it's a black and white legal document that's like, here's what our obligations are. It's just complex enough.
And it's because inmates are no longer eligible for Medicaid when they're incarcerated, so that's kind of what drives that whole.
And so I think there's like, we're still new enough to correctional medicine where we're learning that, but it does seem like it's a double-edged sword. I mean, the way in which people manage that contract can be either very helpful or tricky for the county or for the facility in terms of capturing that cost savings.
How do you guys handle inmate grievances, malpractice, all that? Because,
It happens.
they're inmates, right? Let's face it, that's what they do. If they can find a way to manipulate the system, that's their job, that they're going to do. So how do you guys handle that side of it? Do you have a legal team that?
Yeah, I mean, it really is a case-by-case basis. That was one of the reasons that Columbia County brought us in. Their grievances were kind of through the roof with the previous provider. And since they brought us in and talked to Ward and I about it, their grievances went down practically to nothing until we implemented an MAT program. And so we implemented an MAT program to their benefit, to the inmate's benefit, and then they didn't like the way we were administering the Suboxone to them. And they didn't want the nurse, crushing their pills or, watching them swallow it and this kind of thing. And then so we had some more grievances that were arisen because of that. And then we just address on a case-by-case basis with each inmate and have our legal counsel out of Harrisburg, help us with anything that happened.
I think the foundation of being a pretty good sized practice, the 10 primary care offices and the 80 facilities, is that our malpractice carrier is a pretty good group. So we're turning over
So where's your closest physical office?
the block that way.
So in practice-wide, we care for about 45,000 patients in Pennsylvania, and we're doing over 10,000 patient encounters every month. So, stuff happens where we have legal issues and, questions about quality of care and concerns like that we're no strangers with addressing those issues.
Yeah, you weren't here when Dr. Campbell was here, but they bought his practice.
X-rays, lab work, EKGs, do you all do them on site in jail, or do you send them all out? I mean, I'm sure you have mobile X-ray come in for X-rays, but.
That's what we do, and what we're trying to set up at Columbia is a relationship with Danville, where they send the lab tech in to draw the blood. I mean, currently the nurses are doing it, but my thought is, we're paying for all these labs, we might as well have the hospital send the lab tech over and do it, which is what they do in our offices. So there's no reason why they can't do that in the prison as well.
And then all the other stuff, bandages, Band-Aids, gauze, ointment, wipes.
What facility, non-jail facilities are you contracted with here in Bradford County and Tioga, Sullivan, Susquehanna? Like just local?
Yeah, Bradford Hills Nursing Home, which used to be Bradford County Manor. And then, where else?
Bradford Hills Recovery,
Bradford Hills Recovery.
Broad Acres, which is over in Millsboro, Sayre Healthcare Center, which is up in Sayre, Highlands, which is right down in
Sullivan County.
Fort.
Which is Bradford Recovery?
Is that the one in Mosherville?
It is.
In Athens?
Is that the one, is that the used to be
It's not in Athens, it's kind of very rural. Bradford,
Okay.
It's an Acadia Lake Care facility.
I don't remember the name of the town. It's an old little schoolhouse.
Yeah.
Oh, in
Mosherville.
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 Mosherville, yeah.
That's what I thought, okay.
Wells Township.
Yeah.
Right out,
Nice.
right out.
20 to 25 minutes.
They remodeled it, right?
Oh,
Yeah, hell yeah.
25 minutes from here?
It's maybe 40.
Try, yeah.
What
try
is
closer to
can't
40.
get-
What is it they do up to the Chesapeake Man Camp now?
That's a treatment facility.
But that's
That's
a different one.
That's a different one.
I just wondered, I thought that's the.
I can't remember what that's called.
We're also at Robert Packer Personal Care Home. So we can provide, we have lists of references and all the facilities. I mean, we have a map that lists out all the facilities with contact information, so we can email over.
What's the contract set up like? Is it a yearly thing, certain period of time?
Flexible, probably like 12 months.
What's their contract, 3 years, Michelle?
Yeah.
You're saying Prime Cares is a 3-year contract?
Is that unusual when they go that long out?
Whenever we were reviewing it, we thought that was a little extensive.
But I wasn't sure if there was a 3-year contract with a 60-day termination clause. So you
So that was
still,
kind of our
you
case.
still had
Yeah,
a 60-day exit strategy or termination clause. Yeah.
Normally, contracts do that.
Yeah.
Excellent.
I mean, so, I mean, as we explore and see where everybody's at, where do you think we go from here?
Well, I mean, I think we could probably, with a better understanding of what you guys are looking for, what you need, we can put together a formal offer on what we can provide and what we can do for cost-wise. And you can submit that to the board and have you guys review that and let us know what you think.
You have to run that by Jonathan to see if
Yeah.
we'd be allowed to do that if we're under contract, right?
So the question, I guess, the other question for Jonathan would be whether we would need to, or whether it would be advisable to do it pursuant to a formal RFP, where it's open to everybody, you have certain specifications, and you have certain things that you want to see within the bid proposal. So that's, I guess, another question. Michelle, if you could get some insight from Jonathan.
Did we do an RFP when we brought on Prime Care?
Yeah.
We did? Can you remember how many responses we got?
At that time,
Yeah.
maybe 2. There wasn't a lot.
Yeah.
Yeah, I think corrections care might have
It's-
been one of them, because there was only like 2 or
Yeah.
3.
Yeah, there's not that many.
Fine, anyway.
That was back when everything was kind of a mess too, wasn't it? When it came to doctors and jails and fires and stuff. So, okay. Does anybody else have any more questions?
No, thank you
All
for
right.
the.
Thank you very much.
And you'll need
Very much
you'll
appreciate
need
it.
contact information if we have more follow-up questions.
Are you staying through, are you leaving now or are you leaving right now or are you staying?
We're gonna step out, if you need us for anything else.
No.
Yeah, because I have a couple of
You can stay if you
questions.
want for,
Okay.
I have a couple of quick questions.
after we get done.
So-
James.
Yeah, but,
We're not done with
Almost
the
done
meeting.
anyway.
but these guys want to leave, I think.
No, we'll stay, we'll stay.
All right. Any requests for an executive session? All right, visitors' remarks?
Yeah, I just want to, you're saying that under your proposal, there would be a reasonable amount of medical, like, you said there would be 24-hour care with some sort of nursing staff, like an LPN or less.
You're asking me?
Yes.
Yeah, correct.
What, do you mean 24/7? Is that, are you saying?
24/7.
Okay, just want to be sure. 'Cause
Remember, James, this is just thrown out on the table,
Yeah, this is
discuss
just-
it, and kind of find out where they're at, what we need, and this is just budgetary fact finding, that's all we're doing.
Okay.
Again, we're not taking issue with any of the services that Prime Care has provided at all.
Okay. And then, also Doug, you said something about how there's an alternative way to get mental health, services for the jail
this
that
is-
wouldn't be through these guys?
Yes, preliminarily. I talked to our director of medical, or of human services, Maine, and she said that at that time when I talked to her, that she felt she could provide it again.
Okay.
So, but we would have to take a hard look at that. You know, we're just at the discussion.
And they would be county employees?
We're just
Or
at
they
the
would
discussion,
contract?
but we're just at the discussion part. I
Okay.
don't want to speak for her. I just tell you what she told me.
Isn't her name Sheena something?
That's our HR director.
I mean, name
Name Carter.
Maine Carter.
Okay, and then, also, Doug, you said that under Prime Care, the cost has escalated, I think, I'd have to look at my notes, but it went up this
Yeah,
now.
Dan's not here. I asked him to come up, our CFO, and when we did it, 750 sticks in my head, and that would have probably been about 18, wouldn't it, Michelle? Because when did that pass?
So,
Hold on a second.
20?
Yeah, it's right in 1819, because Ed Buston, that was, he brought this to us, and
So that was, in other words, that was the cost, say $750,000, that was the cost before prime care came.
No,
No, that
it was
was
about
the first.
400, what was it? That's why I wanted Dan here, he's got those numbers, we can get them to you. I think it was like 400 maybe.
But it's not comparing apples to apples, because we hired our own staff and stuff, so I mean, there's a
Well,
number of different nuances.
It didn't have mental health story.
Yeah, but hold on, I think that there was the whole medical piece at the prison, I think that's what it cost us.
Yeah,
So like.
What
you know,
was
I don't
the
know what we paid
400,000?
Dr. Cam, I don't think we paid him that, but it was the whole, medical piece, but we can get that for you through Dan.
okay, so the whole medical piece is what you're referring to before prime care came
Before
and that?
prime care.
Okay,
Yeah,
and
then-
that was the 400 or whatever?
Well, as I remember, this is why I wanted Dan here, we have that on, I can get that to you, the comparison. But today, we're at 1.2 million.
Okay, and then one more question about, you were talking about how, it sounded really good that you could somehow get, I don't know, if you would contract with somebody outside to administer the Act 22, is that it? Basically, you want to limit the amount that the jail could pay for these medical costs, and so
Oh, I see what you're saying, yeah.
So basically, the idea is that you would if you guys if this company came in, Prime Care, wait, what's your name? Whatever.
Spartan long-term care.
Spartan?
Mhm.
If they came in, would you contract with an outside company to do this Act 22 work where they make sure that?
We don't perform that service, but we can make some introductions to other folks that have that ability.
Sean used to do that too, if I remember correctly.
The new laws, you are required.
But I'm talking about before that, she would be calling up trying to get the cost down from the Packers. So yeah, now remember, this is just preliminarily. I mean, we've got a lot to do, and it'd have to be put out for an RFP and different things like that. So, this is just fact finding. That's all we're doing
Okay, and then
on both sides. For you
and-
guys,
Absolutely.
and the name of your company, I thought it began with a P also, but I'm wrong.
We have a couple different companies, but the Spartan Long-Term Care, or Spartan LTC, is the name of the division that handles the current correctional medicine.
Okay, but they're part of this larger company that sees 45,000 patients a year. What's the name of the larger?
Primary care and pediatrics.
Okay. Thanks very much. That's everything.
centrally located in downtown Quantico.
There you go.
Oh, really? You're based here in Towanda?
Yeah, right here.
Okay.
Well, they're not based here.
They have
They have an
office
office here. Okay.
And we're accepting patients.
Great. Any other visitors' marks? All right, hearing none, our next meeting will be at the correctional facility on, I don't have the date, on the
Second Thursday of the month.
second Thursday of the month, at the same time, but it'll be at the correctional facility. So I'll take a motion to adjourn.
So moved.
Second.
A motion and second, we're adjourned, thank you.
James.